health practices, we're going to take a different slant on getting healthy. We have Dr. Kirk Eriksen with us. He is the president of the Society of Chiropractic Orthospinology, and we're going to be talking about pain relief using the Grostic procedure. Now, if you have fibromyalgia, terrific headaches, continuous headaches, if you have back problems, if you have a job like working with a computer or doing something where you're stooped over, if your posture is getting older like mine is, you might want to consider chiropractic care. Dr. Eriksen, good morning.
Thank you for having me.
Tell us, if you will, the difference in your particular form of chiropractic care to, say, a traditional type.
Well, Ann, I'd like to say, first of all, that there's many different chiropractic adjustment procedures in the profession, and all of us are trying to achieve the same thing, and that is help patients with various painful conditions and ill health. So I do not want to imply that the methods that I utilize are necessarily any better than my fellow chiropractors, because I think all the chiropractors in Dothan are doing excellent work. But the work that we do is we focus on the alignment of the head and neck, because what we have found is that misalignment between the head and neck creates stress on the nerves in this region. And when you have stress in this area, it can lead to many problems, from headaches to postural distortion.
Even constipation. You've had a young child, I believe, that came to you, had chronic constipation, and it was because one of the nerve centers was blocked.
Well, again, chiropractic care is not the treatment of diseases and conditions. However, as a doctor of chiropractic, we recognize the fact that the nervous system controls and regulates virtually every function in the body. So if there's an interference to the normal functioning of the nervous system, this is going to interfere with the patient's ability to function in optimal health. So no matter what condition or problem that you have, you're better off having this interference removed as opposed to living with this. So yes, we did have an unusual case of a child, the first case study I ever published in a research journal, a child that had chronic constipation that, yes, did change after one adjustment. And there is neurological explanations for that.
You know, you have a scientific approach. In fact, you've recently been approved because of the type of x-ray technique you use, which is less exposure to radiation.
Yes, I've got a research study that we just completed, that we had a radiation physicist from the Alabama Department of Public Health come to our office and test these filters that we use on our x-ray machine that are made out of lead foil. And long story short of the study is that the 3 x-rays that we take of the neck, the one x-ray utilizing these filters reduced radiation by 65%, the second x-ray reduced it by an average of 78%, and the third x-ray reduced it by 75%. So it is pretty interesting information that has not been published before.
And of course, he is a textbook author. He's also a teacher in the College of Chiropractic Care. And we are going to show you some pictures from his new textbook, and it is awesome. So let's look at it and you'll see. Now, what are we looking at? This is the first thing, and that actually is my husband's feet, I believe.
Yes, this is a recent case. This happened yesterday. And one thing to recognize, the fact that when the head and neck are out of alignment, what happens is the body compensates by causing the muscles to contract unequally on each side of the body. And this is going to cause the posture to be distorted and cause one hip to appear higher than the other. And you can see this because when you lay down on your back, it looks like one leg is shorter than the other, but the legs are actually the same length. Now, this patient here received an adjustment only to his neck, and it was something that, as Ann, he probably told Ann, he didn't feel much at all when we actually made the correction. And as you can see, there's a change of 3/4 of an inch, not in his feet, not in his legs. We're only using the shoe like a measuring tool to measure just how far off his posture is twisted.
And amazingly, he had been having neck problems, and that's where it started, there in his neck. All right, and now we're going to show you some pictures from the textbook. Okay, now we're looking at, I think we've got the book kind of twisted there, but you see the position of the, ultimately the neck alignment is the key.
Yes, these two cases here are two young boys. One is 9 and one is 12. The case on the top was actually published in a research journal. It was an 88% correction of a scoliosis. And yes, many times we see patients with curvature of the spine improve, sometimes minimally, sometimes significantly. And then there's some cases that don't respond that have to be referred out as well.
So you're talking about scoliosis, chronic headache, sports injuries, accidents. When you are in those wrecks and you don't get checked up, that's not good.
Absolutely. If you've been in an accident and you've had a trauma to your spine is out of alignment, you can take medication to cover up the symptoms, but unless the spine is corrected, you're just going to have to deal with this problem down the road. And here are some more cases of scoliosis correction.
Scoliosis, and this is, oh, I love this. This is a little girl. Tell us what you've done for her there. She fell out of the bathtub, I believe, or something.
Yeah, this is a child that actually had been stuck in this position. This is like a torticollis or a dystonic presentation. And what's unique about the change here in her posture, if she'd been stuck in this position for many, many days, is that this occurred after one adjustment.
Wow. And listen, the adjustment is so gentle. I mean, it's not like, I have to be very careful because I had lupus. I have a lot of muscular situations. And I think we have another one, which certainly you have to have. Now, this is your book. Tell us about this very comprehensive book that you have here.
Well, when I went to chiropractic school, I was really so intrigued by the many different chiropractic adjustment procedures that existed. And so I set out to examine all the different methods that were available, and I settled in on this particular method that, as I said, made sense to me, but there's other methods that are very effective as well. What this book is about is a review of over 1,200 research studies in the medical and chiropractic literature that either directly or indirectly relates to the science behind what we do as chiropractors.
Even medical doctors are recognizing. You have some quotes in there from people here in this area
yes,
that complement what you're doing.
Sure. Chiropractic care is not the replacement for medical care.
No, it goes hand in hand.
That's right. Whereas medical care is not the replacement for chiropractic care, but they complement one another. And I think, as you'll agree, that is when patients benefit, is when they can get the best of both worlds if they so choose. So medical care essentially treats the condition that the patient has, whereas chiropractic treats the patient that has a condition. And it's two separate forms of health care. And again, when patients are overwhelmed with a condition or a disease, or they're so severely damaged, these are cases that we will refer to a medical doctor for help. Whereas at chiropractic, we recognize that the fact that the body is a self-healing, self-regulating organism. And what the chiropractor does is remove the stress and interference to the system to allow the body to function better, but we don't heal.
One of the things now here's the information, and if you've got chronic headaches, back problems, another young man who went into the same practice told me he had suffered back pain for years and had been to other chiropractic care providers, but after he met Dr. Eriksen, he got relief and stayed relieved. The number to call locally is 793-7992. You can look through his book, ask questions, or you can look at www.chirohelpinstitute.com. Thank you so very much for being with us, Dr. Kirk Eriksen.